Dr. Steve Bjorn here with Core Rehab. I was going to show you another taping technique that we use a lot for shoulders. There's a mobilization movement technique we do where we mobilize the shoulder blade back and help that shoulder move the way it's supposed to, and then have somebody raise their arm, and if it feels much better, then this is a great technique for that. It is trying to help position the shoulder blade where it should be so that you actually get better mechanics at your shoulder and you can raise your arm a lot smoother and easier. The first layer we put on is the kinesiology tape. Brandon uses rock tape, but you can use any kinesiology tape. And some people, that might be enough, having just the kinesiology tape on there. We want to catch the head of the humerus, the front of it, and come over and diagonally drop down below the corner of the scapula. So the corner of the scapula is right here. I want to make sure I get past that point. And then we'll take another strip, come from just above the top of the scapula and the upper tract area here. And then we'll bring that down and end in the same spot. So for somebody that has a really mild problem with the way their shoulder blade's moving, that might be enough, because then when he slouches and goes forward, he can feel the pull on that tape, and that kind of helps him remember to stay upright and be in a better position. So sometimes that's enough to support it. Usually we'll take a very rigid tape, this is called Luca tape, and it doesn't have any stretch to it the way the kinesiology tape does, and we'll cover over that. So we're going to start on the front right here, make sure we cover up the head of the humerus, and we're going to actually pull it back and down, and we're actually repositioning that shoulder blade back and down like that. And we'll put 2 layers on to reinforce it and change the position and posture of the shoulder and the shoulder blade here. And pull it all the way down here. And then take the other one and do the same thing. So we'll anchor here and pull down, so we're getting that scapular depression dropping down. And that helps the scapula move the way it's supposed to. Cut that one a little bit long. And when you have that position there, and when he goes to raise his arm, go ahead and raise your arm up overhead. That'll help him be able to keep that shoulder blade moving in the direction that it wants to go and should go in order to clear this space so that head of the humerus doesn't bang up into your acromion. So a lot of people that have issues with pain raised above shoulder height, this is a great technique for them. It helps that shoulder blade move the way it's supposed to, can clear that space and make things work better and help them be able to raise their arm with a lot less pain. So any questions or any other things you'd like to see, leave a comment. I'll talk to you later.